Hello, my name is John Thompson. Thank you for joining this afternoon. I'd also like to thank our panelists, Brunson, Laura Mackenzie, and Crystal Anderson. Brunson is the founding partner at Percapita, an emerging financial wellness solution. Laura is the Senior Vice President of Global Consumer Product and Financial Inclusion at Mastercard, responsible for delivering on Mastercard's important and substantial financial inclusion commitments globally. And Crystal is the Vice President of Financial Services at H&R Block. And along with being responsible for the broad portfolio of solutions for H&R Block's customers, she and her team are also launching a new mobile banking platform later this year. So welcome, Brunson, Laura, and Crystal. Each of our panelists' organization are at different stages of maturity with respect to the collection and use of financial health data in managing their businesses. And this is a topic that's near and dear to my daily work. Following several years of service as the Chief Program Officer of the Financial Health Network, I'm leading one of our new solutions, a platform called Attune, which is a B2B technology platform that helps organizations measure and improve financial health outcomes for their customers and employees. So in the context of today's event, our discussion is really focused around the performance pillar of financial health. And as Marissa noted at the start of the event, like with any other company initiative, like expanding a new customer segment or reducing loan charge-offs or driving employee engagement, it's important to understand the current state of an issue, to have a goal in improving it, and being able to track progress towards that goal. And even though financial health might be a new type of outcome for businesses, or it might be measured with new type of data, it follows a similar kind of playbook. And so with that context in mind, I want to dig in a little bit to the concept of performance and data and measurement in financial health with our panelists. And Laura, I'm going to start with you and ask you, what prompted you and your organization, your team, to start working on, thinking about, beginning the progress of measuring financial health? How did you begin to do it? How's that evolved?
First of all, John, thank you and Financial Health Network for having us here today. Very excited to be here. There's a simple and there's a complicated answer to that question. The simple answer is goes back 7-ish years ago now, back to 2014, 2015, when our then CEO Ajay Banga made a commitment to the World Bank very publicly and brought it back to the company. He committed us to reach 500 million people around the globe by 2020 and bring them into the financial mainstream by providing them access to financial products and services to bring them out of the cash-based, unbanked base of the pyramid. Clearly, we then immediately had to figure out how to, A, how to do it, and B, how to measure it. We're very, very proud to say that we met and exceeded that goal 3 quarters early in the first quarter of last year in 2020, in the middle of global pandemic. And then we looked ahead and we realized meeting that, while it was an incredible achievement, didn't eradicate poverty, it didn't alleviate financial vulnerability. So we needed to look ahead and set a new North Star for the organization, and we doubled down and doubled our commitment to reach 1 billion people by 2025, which is now our new goal. But we also did a second thing that's very important to this question. As we measured our progress to our first 500 million goal, we committed to measure to a number. We measured access through Mastercard data, through reported issuer data that our financial institutions are required to report in our systems. We measured new product issuance delivered into the hands of a cardholder, right? So we measured a number. We realized at the end of that the number wasn't enough. We actually had to understand the usage of those programs. Were people using them? Were they just cashing out the funds loaded onto them and putting them back in their sock drawer until the next time there were funds around? And until we could understand usage, we couldn't understand the level of social impact that we were having around the globe in any communities and where the greater opportunities still lied. So finding the data, measuring the data, understanding the data, realizing which data sources we needed to be able to track those things has really taken my team the better part of the last number of years. We are continuously perfecting it, I look forward to the tools that you have as well for that.
Awesome. Well, we'll put a pin in that. We're going to come back to that. Now, Brunson, you're going to be at 1 billion users someday here soon, but I just give you a little bit of trouble. You're obviously coming at it from a different position, but you've made a similar kind of commitment at your organization. Like what prompted you to think about financial health measurement as a component of the way that you're building your platform?
Certainly, John, certainly. I was actually just on the phone with my founder earlier, and we're as excited as you are about the 1 billion users that we'll be working with here in the near future. So we have a lot to look forward to. But, I would start by saying, by way of background, Percapita is a financial wellness company at its core. We are in stealth mode, so we are just about a little over a year old. And so we're incredibly excited about being here and incredibly excited to participate in the panel. My role as partner is to sort of lead how we come to understand and serve our communities of interest, namely marginalized folks, specifically low and middle income employees. And so our core focus is on financial wellness and how we think about that, how we measure that, how we articulate that, how we hold ourselves accountable to achieving that is really what's important to us. But when we started this journey about, just over a year ago in sort of February 2020, we realized that you don't need a ton of proprietary research to understand that income inequality is one of the most pressing issues facing America, right? And sort of after spending over a year in a global pandemic, that has only become more and more clear, right? So we began by asking the question, what are sources of financial harm for folks? What's getting in the way of folks' financial wellness? So we looked at the credit card space. We looked at the student loan space, right? We wanted to understand sort of the mechanics behind these industries so that we could come up with a holistic approach that would hopefully increase folks' financial wellness. But our goal now is to figure out what we can do as a combination of academics and bankers and legal professionals in order to address some of these systems of harm in order to create a new system, a system that supports folks along their journeys towards financial wellness.
That's great. I appreciate that. Crystal, I'm going to ask you to touch on this too, but maybe in a slightly different way. You have a mix of very mature product sets in your portfolio and then this new one that you're launching as well. So given all of the priorities that you have to manage with sort of installed existing legacy product bases and the sort of emerging challenges of building new products, how do you think about prioritizing the resources and what pushed you and your team to make this commitment around financial health measurement?
Yeah, first I'll say I found myself continuing to nod as my peers here were talking and saying things like, wow, and then forgetting I was on camera. So I'm assuming we can't see everyone else's faces, but I'm sure everyone else is feeling that way. You just have really said some remarkable things. So to my panelists, just incredible work you guys are doing. But yeah, John, to answer your question, it takes people and dollars, sure, and it has the potential to really compete with other needs of our organization. Thankfully, we quickly realized that it had to be aligned at all levels. I think Reba said earlier, all the way up to the board, and so we needed alignment all the way. And we don't always refer to it as financial health, but the concept and spirit of it is woven into everything that we do. When we saw real alignment, when we really embraced it as an organization. And we started with redefining our company's purpose. And you hear it in the language. It's now providing help and inspiring confidence in our clients and communities everywhere. And that's this really inspirational purpose for us. But then everything we do aligns to that. It's accounted for in our 5-year financial goals and our strategic imperatives. For example, the financial products imperative that my team owns is to develop new products and experiences, and this is the wonderful part, that create confidence and ease financial burden. And then all of our projects are prioritized against that. Only the things that align to our purpose and contribute to our ambitions and deliver on that promise are the ones that get funded. And then recently, we restructured the company and dedicated resources to align with this strategy. So a very holistic approach, including the culture. We have a culture that's very committed to belonging and inclusion, which is especially important as we've learned from FHN, that there are disparities in financial health across race and income and gender. And so as you can imagine, change like that takes time. It takes everyone's buy-in, but it also takes real commitment.
I appreciate that. Thanks, Crystal. I'm going to put this to each of the three of you. As you think about your ongoing journey around financial health measurement and the data that you're acquiring and using to support that, how do you, as organizations, as teams, as products, how do you expect to derive value from that? And what are maybe some of the early proof points that you're looking to for that? Laura, you got a pretty strong top-down mandate and a problem to solve. But how do you all expect to gather value, deliver value with this sort of assessment methodology?
So let me use some real examples that we've only just cracked the nut on, literally, almost this past week, but we don't have to tell anybody that. So I mentioned earlier that in our first goal, we committed to measuring access. We committed to delivering against a number. Wonderful. We met that number. And as we're going forward, we realized if we don't understand more of the programs that we put to market and what they're doing, then we really don't understand enough about what more we need to do. What do we need to change? What do we need to do differently? What do we need to stop doing? So we set about to actually measure usage. In order to measure usage, we have to be able to have a view into the actual individual portfolios that we're delivering in each market. Are they social benefits disbursement? Are they payroll for migrant workers? Are they pension plans for the elderly? What in fact are they? Are they transit programs that are enabling the unbanked to stop using cash and get into a financial mainstream with a digital ID? We obviously didn't have 5 years of back historical data that we could churn through and analyze, so we're building a new database going forward, right? So we have to start from scratch. We've really just cracked the nut on how to use our own data sources to do that, and what it's allowed us to do, and we're incredibly excited. I feel very geeky about this. We now can look at the actual portfolios that we have delivered at a country level, at a regional level, and at a product level to understand what's the makeup. Are they largely prepaid cards? Are they largely debit cards? What's the actual percentage of utilization at a country level and then at a region level? Are there some countries that have 12% utilization and others at 80 that, averages out? How does India's COVID situation impact the overall delivery for Asia Pacific in total, right? And one of the things that we now know, right, Mastercard does business in 210 countries and territories around the globe, but we've been measuring reach in about 170 countries, right? There are some countries that are marginally so small. There are some countries that are sanction driven, we can't do business in, right? So we don't measure from every country. But what we now realize as the 80-20 Pareto principle that we all know, over 50% of our reach has actually come from 8 countries. And add another 70 countries, add another 7 countries, 15 of 170 countries give us 3/4 of the reach that we have had. So that allows us to look into, are we putting our resources in the right place? Are we getting that reach because those countries are resourced, either human teams on the ground or funding behind it? Or are there other locations, Indonesia, I'm just going to make one up, versus Pakistan, where we should, the opportunity is massive. The percentage of underbanked or unbanked in that country is significant. Maybe regulation kept us out. Maybe nationalism kept us out. But it allows us now to actually look to see strategically, are there new opportunities to prioritize? Should we be working more closely with telcos? Because the proliferation of mobile handsets allows us access into customer bases, right? So having that data, having that lens into what we've already done is immeasurably important to us.
I really appreciate that. And you're obviously dealing with a global set of challenges, problems, and opportunities. But those sort of same kinds of models we can bring back to our own markets that each of us are working on, and think about the differences that exist between the micro markets that we're serving. Brunson, I'm going to come to you in a second, but Crystal, I'd love to have your take on that. How is it, maybe expanding on the comments you made already about the sort of strategic commitment that you've made around financial health. How do you expect the organization to derive value from the investment that you've made in this area?
Yeah, I would say tying that strategy in the spirit of financial health to business growth. The example I'll give is it's really easy to look at things like savings accounts and free credit scores and free overdraft and only see the expense that it drives. But when you have a customer who feels like their financial institution is committed to their financial health, they're likely to be more satisfied, and they're more likely to recommend, and more likely to retain, and more likely to purchase or engage with other products. And you just can't argue with that. So by measuring financial health, we can now draw that connection where we can take those value-added features and really see how it's driving business growth.
Is it right to interpret what you're saying? You think financial health movement could be a leading indicator to other kinds of business KPIs that the company already has confidence in?
Yeah, I mean, we certainly see that in your MAP assessment, in your maturity assessment, and then that's one of the things that we're looking for, and it becomes that leading indicator for us, but you have to really be committed to it, because the proof isn't always in the numbers in the beginning, especially as you're building out a new product like we are. We have to really make that big assumption that we believe this is going to tie to business growth, and we do.
Great. Well, Brunson, one of the reasons we wanted to have you in this conversation is because financial health measurement and action around financial health data is not the domain of large companies exclusively. Like, it can work in small and mid-sized firms, even ones that are emerging. And so, I think I'd like to have your answer to the same questions. How is it that you expect this to guide the way you develop and build products, the way that you provide value to the customers that you have? Where are you thinking about the value from your investment in financial health?
Absolutely, John. I mean, I think this question about the value of measurement is certainly not one where the answer is unequivocally positive or unequivocally negative. We at Percapita, we firmly believe that measurement can be a double-edged sword, right? It offers concrete metrics by which to evaluate success, but in the same way, however, it reduces success to only include specific metrics, the efficacy of which, as my peers have sort of indicated, may be unclear or misleading or poorly founded or not exactly in the spirit of what we were after in the first place. And so it's important to acknowledge that up front with measurement. When I think about how we think about the value that will be derived from measurement as regards our clients and our users, we think about sort of the emotional experience of interacting with us versus interacting with a typical banking institution. The typical banking approach to serve a low-income family means telling them no, or charging them excess fees, or in some cases denying them access to necessary tools to participate in the modern economy. Our approach, by contrast, is to find ways to be more flexible, different metrics that importantly create trust between that low-income family and Percapita. The question then being, how can we rely on those metrics to turn those no's into yeses and provide greater access to the tools that support people's real needs?
I appreciate that. Thank you. Laura, something you had said before, you built these, but it sounded like essentially proprietary methods to assess reach and essentially usage. How are you starting to think about the impact of that usage? And I know you've looked at financial health measurement as a strategy, but how important is that to have maybe confidence in the impact of that usage? I'm tying this together with Brunson's comments about, if you measure something, like, you optimize for that thing.
Yeah, so John, it's a great question. It's a really important one, and it's one that we've spent a lot of time on. So, two important factors from a Mastercard perspective. The access and the usage are two things that we can measure with our own data, right? We see the transactions, we know the portfolios, we get reporting from our issuers. We can do those. It took some time to build the methodology and build the models, but we can do that with our own data. Social impact, we cannot do with a Mastercard lens at all. We need to determine the KPIs. We need to determine, what does social impact mean, right? Have we enabled the community to pay their school fees and raise the level of education of their daughters? Have we enabled people to get vaccinated? Have we enabled people to keep the electricity on at night, or get credit for their businesses? We need external sources of measurement of those elements that we determine are what means impact for us. How has financial health led to actually an improvement in somebody's lives? So first, we have to determine what the KPIs are. Second, we have to determine who is a globally recognized, reliable source of that data. Third, is that data source something that is refreshed with regularity, right?
Yeah.
What happened pre-COVID versus post-COVID is a completely different lens, as you well know from Measuring America. So And then we have to bring it all together. We have to strike relationships with the data providers. We have to build it into a model. We have to marry it back to our data. We have to make it auditable, and all of those things that we all spend the behind the scenes time on. But it's anything but easy. And, it's when you're not using your own data and you have to partner with other sources, right? The level of scrutiny that we must go through, the due diligence to really understand that is significant.
Awesome. I appreciate that. I'm going to pull in one question. We're going to have to go pretty quick with this, but I want to pull in a question from the audience. Crystal, I might start with you on this. I'm wondering if you have approached this in terms of leading and lagging indicators, essentially how you would determine that a leading indicator ties to a lagging indicator. Like how rigorous would that kind of process be? How long would that take you? What sort of approach would you take to it?
Yeah, well, John, you know this. We've embraced the Financial Health Network's framework on financial health. And so we're really focusing our product on the financially vulnerable and coping. And we'll work to really quantify where they are. And then we'll evaluate all of our activities against that. Is the insight working? Are we starting to see improvements in credit scores? Are we seeing someone spend less than they make? Are we seeing savings with a plan? All of those things that we know are real indicators that someone is what I call moving up the continuum of financial health. And we'll continue quantifying that for them, even in some cases real time assessing where they are, and then looking at our business metrics to make sure that they're aligning to that too.
John, can I just jump in on top of Crystal?
I was hoping you would.
I don't want to take time, but she just called attention to a really important thing for me personally, and which is where the financial health check becomes so important. Mastercard does not own the customer relationship ever. Our customers own the customer relationship. So we can't assess the health of an individual customer. We have to turn to our customers and ask for their assessment of the health of their portfolio, right? So exactly what Crystal has just described is that data that we need to pull out from all of our various issuing partners around the globe to actually understand the level of health that our portfolio holders have. So I just wanted to make that connection because it was really important and well said. Thank you, Crystal.
I appreciate that. Brunson, Laura, Crystal, thanks for being here. Thank you for your commitment to this work, both within your own organizations and with the community of all of us that are around you trying to help you. So appreciate your leadership. Stick with it, and we wish you the best of luck in your journey. As I noted in the introduction, the team here at Financial and Health Network has built a technology platform to help try to make all of this a little bit easier, a bit more tangible, a bit more actionable as you get started. And the product is called Attune, and we've put together a short video to help share a little bit more about this. So again, thank you, Brunson, Crystal, Laura. Really appreciate having you here today. At Attune, we believe in a world where all people can be financially healthy, and we know that financial well-being is a value driver for businesses and organizations. Therefore, our mission is to make financial health a cornerstone of your company's success. We provide you with the tools to turn customer and employee financial health needs into new or improved products, services, messaging, and benefits. Developed by a world-class advisory council and backed by years of research from the Financial Health Network, Attune is a digital insights platform that helps you optimize for financial health through data measurement and analytics. Here's how it works. Attune's proprietary financial health quizzes help you capture how your customers or employees save, spend, borrow, and plan within minutes without needing a research team. These personalized quizzes are clear, quick, and conclude with immediate action steps. Using the automated recommendations in the dashboard, you can improve or develop new products, services, messaging, or benefits for your customers and employees and track their progress over time. You can personalize solutions for individuals and demographic groups, giving you ultimate flexibility to address the needs of your stakeholders. Track the financial health of your customers and employees as they adopt the programs and services that you have created. See the return on your investment grow as the financial well-being of your stakeholders increases. At Attune, data safety comes first. We invested in security and compliance from day one, with dedicated security protocols and continuous monitoring that go beyond industry standards to keep your customers' data safe, private, and protected. Our scalable platform can be used both as a standalone solution or integrated seamlessly with your digital platform. Financial health is more important than ever to both your organization and to our society. That's why financial institutions and employers across the country trust Attune to help them improve the financial health for those they serve. To get started, visit attune.co and complete a customer application today.